Okay. All right. So thank you for joining us. This is going to be a discussion about the OB module that there will be
There
quite
will be.
health centers that are going to implement that very soon. We've got Ian and Jennifer from Azara here to talk about the module with you, and I'll go ahead and hand it over to Jennifer.
All right. Good morning, everyone. Thanks for joining us. If this is your second time, feel free to stop and ask questions maybe that you hadn't thought of till after the demo on Monday. Nice to meet those who weren't here before. I'm your client success manager for Kansas. Look forward to working with y'all with anything else you have going on this year. But Ian is going to be here to show you the demo and answer any questions.
Perfect. Thanks, Jennifer. And I'm going to go ahead and share my screen, but I'll reiterate what Jennifer just mentioned too, that as we run through the maternal health module here, feel free to add things in the chat or even come off mute and ask those questions because this is really meant to be your time. And for anybody I haven't got a chance to meet, Ian Farquhar, solutions engineer here with Azara, work closely with the rest of our teams. They usually call me in to show networks and PCAs and organizations like yourself different components of, I'm going to call it Azara's ecosystem. But again, focusing on today, we are going to take a look at what we call our maternal health slash OB module. And really, with this module, it's about focusing on supporting organizations like yourself around all things with their prenatal and postpartum populations. And we'll talk through different pre-visit planning type of components. We could talk through different stock reports that come with this. The whole idea is your teams don't have to manually chart chase for information across the different pregnancies. Again, this is something that we go in there with drives, with our connectivity to your EHR, and we pull all this different data points through templates and fields and radio buttons, and then we present back to you across our different dashboards and reports and registries themselves. But the big thing that I wanted to highlight here when we talk about this module is it's all based on episode logic. So we're really focused on specific pregnancies versus all time with the patient. So for example, if a patient had a certain type of screening, let's say glucose tests, and that patient just had that 5 months ago, if that was done during a different pregnancy, or even if that patient was not pregnant at the time, these are things that's going to highlight again and require that patient to get done again when you start looking at the prenatal passport or the different type of reports we highlight for you. So just keeping that in mind that again, this is very much episode-based reporting logic when we look at this different module. So what's included? So when we talk about really this module, it starts with a set of PVP alerts. If you recall, that's what we call our patient visit planning. It's a pre-visit type of component to drives. So it's different alerts that we can highlight for your teams as part of that area of drives. On top of that, too, those alerts can also populate as part of the EHR plugin. So for any of those teams who are leveraging that today with their either next gen or Athena ones or ECWs or Epic type of EHRs, again, we have that plugin that allows you to pull up any of those type of alerts while you're actually in the chart. And those same level of prenatal and postpartum alerts that can be enabled through this module can also populate there on that actual EHR plugin view also. We'll talk through a prenatal passport. This focuses on summarizing prenatal care for individual patients and looks at screenings and recommendations at different trimesters. We'll talk through, how we ingest those ACOG type of recommendations when we break all that out on the prenatal passport too. But also understand that that prenatal passport, just like the alert side, is something that you can access via that EHR plugin. And then last couple of components here are the maternal care management report. So this is more of a comprehensive view of all your patients who are pregnant. It's getting more into specific actions needed for like outreach, or if you're presenting this data to, let's say, your leadership or your committees, or maybe there's a grant that's running behind the scenes that you need to submit data for. That type of report really aggregates all the information for you. And then the last piece here is something component of what we call Azara patient outreach. So some of you maybe are leveraging this today, or some of you maybe seen it at our user conferences and different webinars. But Azara Patient Outreach, APO, is Azara's set it and forget it type of texting tool. It allows you to enable campaigns to go out to different populations. Again, it's all set it and forget it, meaning that you don't need to do the actions of sending these different text messages out. You create the campaigns, you enable the campaigns to go out to those different populations then, and then from there it automatically goes out on your behalf. But through this module, there's additional campaigns that you can also enable based on your prenatal and postpartum populations also. So getting more into the details like I talked about right there, starts with that patient visit planning alert side. So I mentioned there's a whole set of alerts that can be enabled as part of that PVP for that chart prep as your MAs and nurses are working with that provider regarding that patient. This is also something that can populate too as part of that plugin view. So I mentioned that these plugins, the specific alerts, these will populate for the next gens and ECWs and Athena ones and Epics. So if that's something you guys are leveraging or see today or have purchased in the past, those same alerts will also be able to see there while you're actually inside the chart. Now from there too, you see for the based on this module, there's a PMP that would populate next to the patient's name when they're pregnant. And this allows us to then pull up what we call our prenatal passport. So this is a more aggregate, summarized view of really that patient and that single pregnancy. And it really lays out the patient and where they are with that pregnancy. It's really broken down a few different areas. It starts with what we call the flow sheets. And this is where we can look at different gestational weeks and lays out all the visits and what's changed in key areas. And we can look at things like weight and presentation and fetal heart rate. The next section here is screenings. And this is where we get to be able to track the different screenings that need to happen at different trimesters. Some of these screenings may also show up multiple different times, and that's, okay, because that's all recommended based on ACOG. So once again, we take into these different accounts based on ACOG and their recommendations. And then when we look at these different pregnancies and the screenings that are due at each type of trimesters, this is all things that we call out for you, including things that are incomplete or even something you've completed self. And then the rest of the sections gets more into, the rest of the data that we've already summarized for you as part of drives. But again, we put it at the forefront when we talk about the passport. So it's things around allergies and risk factors and diagnoses and, looking at social drivers of health or even pulling in HIE information. So this really helps the providers and the care teams while they're working with that patient regarding that pregnancy to understand, really the complexity of what they're working with in that moment. There's also medications and appointments we can pull in. I know one of our calls earlier this week, there was questions around the risk factor side. So, again, that's something that we highlight for you as part of this prenatal passport. And even more so when I talk about the maternal care side, report what lives and drives, these are all things that you can slice and dice and see firsthand too. So I mentioned a couple times the plugin, but I just want to point it out again here. So for anybody that is not familiar with the plugin, it's really our point of care tool that's associated with Azara, but it puts the alerts and risk adjustment factors and even referrals, and then really the prenatal passport at the forefront of while you're actually in the patient's chart. So this doesn't require your teams to toggle between drives and the EHR. If you're looking to have insights to this level of data, specifically those alerts or even pulling up those prenatal passports, that is something you can do firsthand while your providers and or nurses or MAs are actually inside the chart for that patient. And we do this again today for our clients who have Athena 1 and Epic and NextGen and ECW. So if this is something that you don't currently have or leveraging a day, definitely happy to coordinate with you guys, Jennifer, Kansas team, around some of this extra information as it's required. Back to the last couple of components of the module, though, back to the OB side. So, I mentioned there's a maternal care management report. This report displays really more detailed information about a patient's episode of that pregnancy, but it's more global view. And it starts with like the status of the screenings completed each trimester. But as I mentioned, it's really meant to be that more comprehensive review and then also support more the outreach side. So something that your teams can really review and monitor. And then when it comes down to, working with those MAs or providers and you want to do some type of outreach or follow-ups or recalls based on for these patient populations, this is something you guys can sort and filter and really get down to that specific level of information as needed. The other component that I mentioned too earlier was something called Azara Patient Outreach, so APO for short. It is Azara's set it and forget it type of texting tool. And this is something where we have a lot of different types of campaigns that can be enabled. And then it's your wording. So however you want to address your patients, it's your frequency, it's your cadence. But then from there, once you guys are really set with what that campaign looks like, you are automatically sending this out through drives to that population. But the nice thing is with this module and the new data based on your OB population, there's additional type of campaigns that you can enable as part of APO. And this is something, again, you control the wording when these go out. And then on the drive side, there's other reports that shows you really your impact or effectiveness or your engagement based on those campaigns too. It's not just OB driven. There's other campaigns around chronic conditions and screenings and assessments. But again, as part of this module, there's some complementary pieces where we are able to enable or provide you some additional campaigns if you already have APO running behind the scenes. There's also another component too that goes back to how all this data just connects across our ecosystem. So we have something also called Azara Care Connect, ACC for short. You've maybe seen it across the different webinars or again back to that user conference. ACC is really our care management and even care coordination tool. It allows your nurses or care managers to build out care plans and define tasks. This doesn't need to be done during sticky notes or in Excel files. It's all really summarized and documented as part of what we call ACC. But one of the cool things as part of this OB module is if you are focused on some more active care management for some of your high risk pregnancy patients, that's another type of cohort that we can bring in as part of ACC. And this is a lot of different type of cohorts and populations we can populate as part of ACC for you. So it's not just pregnancy driven. We can focus on chronic conditions or member rosters or barriers to care. But as part of this module, as we talked about, really focusing on your pregnancy patients and high risk, that is another thing that your nurses, your care managers, as they're working with that population, they could bring in tasks and build out different care plans too. So once again, if there's more information you guys need on that, happy to provide that. I think I see Terry and Alice are adding some things in the chat too. So super helpful for just some content at our website if you guys have interest in that. Last thing from my side, and I'll keep monitoring the chat or we can open to questions too. But just from a timeline standpoint, from getting this up and running, pretty light uplift from both what we see our client standpoint, but then also from an Azara standpoint too. Think of this as a 4-step project that really could have you guys up and running in, call it 4 weeks. It starts with a kickoff where we work through some workflows and understand like how your OB program is operating and where you're documenting this data as part of your EHR. From there, we run through a data validation just to make sure the data we're pulling over reflects accurately what you anticipate inside of drives and inside the prenatal passports. Together, we sign off saying everything looks good. And then there is learning labs and there's a whole academy for you as part of the Azara ecosystem. So you guys are trained of how to use the different reports, enable different alerts, and then also to how to review and monitor that prenatal passport also. a lot of information for Thursday morning. Recognize that. But thoughts, questions can open it up at this point for the team. No questions. Well, like I said, there's a ton of content too on the website, or you're happy to work with Terry and Alice too. So if we need to do a further deep dive or a one-on-one for the teams at the health centers, working with Jennifer, we can always schedule that too. But Terry, Alice, anything guys from your end before we let go?
I did want to let everyone know that Jennifer already has the 8 health centers that you all are a part of that were interested in implementing this module. You're already in an implementation queue. You will be receiving an addendum to your sublicense agreement from us, just basically saying that, yes, I understand that we're implementing it and Community Care is paying the first year of the maintenance fees, and then you'll take it over after that. But that's not going to, signing that isn't going to stop the implementation. So we'll just kind of do those in parallel. Okay, well, if we don't have any questions, I'd like to thank Jennifer and Ian. Jennifer, did you want to say something?
Nope.
Oh,
I was just
all
going to thank everyone for coming like you were.
right. Thank you all. Have a great rest of
Yeah, have
your
a
day.
wonderful day. Bye.